My name is Jayme Ching. I'm a student with Maryville University in adult health assessment, and this will be my head-to-toe video. This is my patient. Her name is Allison. She's 17 years old. Prior to beginning the exam, she's already used the restroom, emptied her bladder, changed into a patient gown. We've completed her vision exam with the Snellen and Rosenbaum chart. She does wear glasses, however, her corrected vision is 20/20. And with that, we will, vital signs. We took her vital signs. Her pressure is 116/70, heart rate of 75, breathing 16 times a minute, and afebrile at 98.2. So with that, we'll begin our head-to-toe exam. First, just a visual inspection of her head. Her head is normal cephalic. I don't see any outright obvious trauma. She's awake, she's alert, she's pleasant. Her face, her eyes and ears are symmetrical in proportion to her face. Her nose is midline. Her skin is normal color, and I don't see any outright obvious rashes, lesions, anything like that. So moving on to palpation of the head. I'm just going to touch your head. Let me know if anything hurts you. If you have any tenderness when I push on you. I don't feel any masses, no bumps, no lesions noted. When I push on your frontal sinus, do you have any pain? Maxillary sinus? No? What about your nose? Her nose is midline. There's no deviation and there's no tenderness to palpation. If I touch you here and here, is it the same? Here and here, here and here. So her sensation is intact in her face as well, and then just some facial movements that I want you to do to test the facial nerve. Go ahead and squeeze your eyes tight. Let me open. Good. Wrinkle your forehead up. Keep it there. Good. Puff your cheeks out. Smile big. Stick out your tongue, and move it side to side. Good. And so that her facial muscles are all intact, her facial nerves as well. And moving on to eyes. So her eyes are appropriately positioned for her face. They're symmetrical in shape, they're symmetrical in size. I don't notice any ptosis or drooping of her lids. Her lower lid has no inversion or eversion. Her eyelashes curve up and away from the eye. Her eyebrows are symmetrical in size and shape, the distribution of hair and texture, and they extend all the way to just past the outer canvas of the eye. On her eye exam, there's no redness of her eyes, there's no drainage, there's no swelling, there's no periorbital edema. Her sclera is white. And then just taking a look into her eyes. Actually, before we do that, let me just touch your lacrimal gland and lacrimal apparatus. No pain or tenderness when I do that. And then look up. Her conjunctiva is pink and moist without any drainage. Okay, and then just taking a look at her eye, to her ocular pupils. Good. Her pupils are about 4 millimeters. Go ahead and look straight right here at my stethoscope. Her pupils are about 4 millimeters and brisk. They're equal. They're round. They're reactive to light and to, nope, keep your eyes straight. Let's do that again. To light and accommodation. I don't notice any nystagmus or drifting in her eyes when we do the cover-on-cover test. And I'm going to have you just follow the tip of my pen. Keep your head nice and still. Good. Perfect. Good. Let me just take a look into your eye. So I want you to kind of focus on the wall, kind of keep a fixed eye. I'm just going to take a quick look into your eyes. If you have any pain or it's too bright or anything, just let me know and I'll stop. So first, so I got to find the red reflex and then moving in. Her optic disc is well visualized. It is a yellow pink in color. Same thing, kind of try to find a spot on the wall there and kind of keep your eyes straight. Following the red reflex and then moving in. The edges are well defined. Here, sharp margins, and I don't see any bleeding or hemorrhage or noting of the vessels. And that concludes our eyes. So moving on to the nose, we said the nose was midline, there's no deviation, there's no tenderness to palpation. If you cover one nares, can you still breathe? How about the other side? Okay, and then just kind of visually inspecting. I don't see any drainage. I'm going to have you look up. Okay. It is just pink and moist. You can see the turbinates. There's no bleeding. There's no deviation of the septum noted. Okay, sorry. Moving on to the mouth. Her lips are pink, they're moist, they're symmetrical, there's no lesions, there's no crusting, there's no edema noted. Just going to inspect your mouth. Oral pharynx, so open your mouth big for me. So her buccal, kind of chin up here. Her buccal mucosa is pink, it is moist. I don't see any lesions. Her teeth are all present, they are intact. She has very good dental hygiene. No, do you have any pain in your teeth? No, I don't see any loose teeth. I don't see noted any caries. Her gums are without gingivitis. There's no bleeding noted. Clench your teeth tight. Good. Open. Stick your tongue up. Let me look underneath your tongue. Good. Let me look on the far side of your tongue. Just kind of push that out of the way. Nope. Okay, and the other side. Okay, then push against my tongue blade with your tongue. Good. And same thing. Good. So her strength is good in her tongue. I'm going to look at your hard and soft palate, your posterior pharynx. Good. Her tonsils are maybe 1+. The uvula is midline. Everything looks nice and pink and moist without any exudate. I'm sorry, but I got to test your gag. Yeah. Sorry. Okay. And she's got a positive gag reflex. Okay, so moving on to the neck. Inspection of the neck. I don't see any obvious masses. I don't see any obvious discoloration. I don't see any goiter or anything like that. I'm going to just kind of touch the neck. Again, I don't palpate anything. Palpating her lymph nodes, so the pre-auricular, post-auricular, tonsillar, submandibular, submental, cervical and deep cervical chain, post-cervical, and occipital. Anything hurting you? Palpating? I'm not able to palpate any lymph nodes, and that's a normal finding. Go ahead and let me just have you turn a little bit that way so I'm going to palpate your thyroid. Okay, and swallow. Okay. Good. Go ahead and turn back towards me. I'm going to just test your range of motion of your neck. So I'm going to turn it all the way to your left, I guess, your right, all the way up, and all the way down. And then just to my hand against pressure, so turn that way. Perfect. That way. And then I want you to shrug your shoulders up tight. Good. So spinal accessory muscles intact, or nerve is intact. So that is the neck. Moving on to her upper extremities. Go ahead and just put your arms on your lap for me. Sit upright. So her arms are symmetrical in size, in shape, and muscle mass. Her skin is uniform in color. Her skin is warm to touch. Her nail beds are nice and pink. She's got wrist cap refill. Bilaterally. She has very sparse distribution of hair on her upper extremities, but I would expect that because she's of Asian culture. And then maybe just palpate your pulses. She's got brisk pulses. Moving back to the neck, I did not palpate her carotid pulse, I don't think. Carotid pulse is 2+. And then just auscultating the carotid and thyroid for a bruit. With the bell of the stethoscope, take a breath and hold it. Okay, breathe. Again, same thing on this side. Breathe. Okay. Did I test your hearing? I'm going to go back to her ears. I missed her ears. So first, begin with the whisper test. So let me have you kind of cover that ear. Tell me if you can hear what I say. Okay, other side. Okay, good. So she's able to hear with the whisper test. Doing the Weber test, I'm going to put this on top of your head. You're going to tell me if you can hear it on the left side, right side, or both. Okay, then I'm going to touch behind your ear. You'll tell me when you can no longer hear it. Use the clock on the wall there, and then I'll move it to the front of your ear and tell me when you can't hear it. Same thing on this side. Okay, and then just inspection and palpation of the ear. So anything hurt you when I touch you or pull? I don't palpate any nodes, no masses. I don't see any redness, no swelling, no visible drainage in the external canal. Taking a look at the inner ear. It has a maybe minimal amount of cerumen, but her tympanic membrane is pearly gray in color. It is translucent. I don't see any redness or bulging. Same thing on the other side. And this ear is similar as well. No redness, no bulging, pearly gray color of the tympanic membrane. Okay, so we did head, eyes, ears, nose, throat, neck. I don't know that I palpated for supraclavicular lymph nodes, which is the top under the sports bra here, but I don't palpate any nodes there as well. Okay, I'm going to have you just turn real quick that way, and we'll do your back. I'm going to listen to your back, so if you can just turn a little bit, and then kind of pull your shirt all the way up for me. So on the posterior chest, so just beginning with inspection of the chest, I don't see any outright abnormalities. Her breathing is symmetrical, it's unlabored. Her skin tone is uniform, it's normal. I don't see any diaphoresis or anything like that. I'm just going to kind of quickly push on your back. Tell me if anything hurts you, your ribs when I touch you, anything hurting? No? Okay. And then we're going to percuss the lungs. So I'm going to, I want you to take a big deep breath, and then take a couple breaths and then a big breath and hold it, okay? Wait, I gotta get some. Okay, go ahead. Sit upright. Okay. Just mark that right there under her. Okay, breathe. And then I want you to take a couple regular breaths and then take a big breath and let it all out. Okay, press up. And work that. And then just measuring that, it should be between 3 to 5 centimeters, which hers is 4, which is normal. Go ahead and breathe normal. So that is for diaphragmatic excursion, and that measures the distance between the diaphragm when her lungs are fully expanded and fully collapsed. And we should do the same thing on the other side for purposes of time. I'm going to skip the other side. And then to measure for thoracic expansion, so nice and upright for me. Just going to palpate the costophrenic angle, which is right there. Take a big deep breath in and then out. And she's got good symmetrical expansion of her lungs bilaterally. And then, because I forgot, let's just have you say 99, 99. Real loud. 99, 99, 99, 99, 99. Good. Okay, go ahead and turn around towards me. Oh, I didn't listen to your lungs. Sorry, stay there. Big deep breath in and out with your mouth open. Sit straight up, please. Okay. Okay, go ahead and turn around towards me. So we're going to, again, so sit nice and straight up. Just visual inspection of the chest. So her respirations are even. They're unlabored. I don't see any accessory muscle use. Her rate is about 14, 16 times a minute. I don't hear any audible breath sounds. I don't hear any bronchi or rails when she's talking or when she's breathing. I don't hear any expiratory wheezes that are audible. I didn't hear any adventitious breath sounds when I auscultated her posterior chest. So visual inspection of the chest is normal. Next we'll begin with palpation. So I'm just going to kind of quickly push on your ribs. Tell me if anything's hurting you. No pain anywhere. Okay. I also don't know any abnormal cardiac, so I don't see any heave or lift or anything like that in her chest. And then we're just going to percuss your lungs here. Lift your arms up for me. Okay. Put your arms at your side. And then we're going to listen to your lung sounds and then listen to your heart sounds. So first your lungs. So arms up, nice big breath. Good. And then just arms at your side, breathe normal. Just going to listen to her heart tone. So starting at the aortic area, second intercostal space, right sternal border. Pulmonic area. Erb's point. Tricuspid, sorry about my hands here. then mitral. And her heart sounds are regular in rhythm. Her rate is about 70 beats per minute. I hear S1, S2. I do not auscultate an S3, S4, a murmur, a gallop, a click, or a breath. Okay, so that concludes the cardiac part. Let me have you go ahead and lay flat. Let's do your abdominal. So beginning with inspection, abdominal inspection. So her abdomen is flat, it's non-distended. Her skin is uniform in color. I don't see any abnormal venous pulsations. I don't see any masses. Lift your chin up for me like you're doing kind of like a perfect. So I don't see any hernia or anything that pops up. Next, we're going to begin with auscultation, starting at the right lower quadrant. We could auscultate for up to 5 minutes if we didn't hear vowel sounds. Auscultating the aorta, and then the renal and iliac arteries for bruit. Her vowel sounds are normal active. I do not, in all 4 quadrants, and I do not hear any bruits of her abdominal arteries. Moving on to palpation. First, we're going to begin with light palpation in the right lower quadrant. Let me know if any of this hurts you at all, okay? If you have any pain. Nothing hurting you there? Okay. We're going to move on to deep palpation. Anything hurting you? Nothing? Okay. Next, we're going to try to percuss the border of her liver. So, starting at a tympanic area, moving up to an area of dullness. Take a big breath. And then I'll just mark there. And then it's a little bit difficult because of her sports bra, but we'll start up in her lung and try to percuss down to the area of where it gets from resonance to dullness. Mark that. And that should be between 4 to 6 centimeters, which would be a normal liver size. Next, we're going to try to percuss the spleen. So going again, from tympany up to dullness. And along the axillary line as well. And then kind of some deep palpation, trying to see if we can palpate the liver. Big, deep breath and hold it for me. Does that hurt? I'm sorry. Okay. Same thing on the other side. Big breath. Okay. And I'm unable to palpate her spleen or her liver, which is a normal expected finding. I'm going to try to see if I can palpate your kidneys. And I cannot palpate your kidneys, which is normal. And then lastly, let me just have you sit up at the edge of the bed. Looking at her legs, they are symmetrical and uniform in size and shape. Color of her skin is symmetrical. It's nice. She's got a nice tan going on here. Again, very minimal distribution of her hair. Her skin temperature is warm, palpating dorsalis pedis, posterior tibial, and popliteal arteries. I don't notice any edema of her feet. Her pulses are 2+. And then just lastly, nerve reflexes. She's got 2+ of her patella, Achilles, normal, and then brachioradialis. Make a arm for me. Good. Relax. Okay. Turn your head this hand. Just want to relax. Triceps. Good. Here. Make an arm. Relax. Make an arm. Okay, relax. Okay, here. Relax. Good. And lastly here. Okay. She's got 2+ reflexes throughout, which is normal. Oh, I didn't expect your spine, so just stand up and bend over for me. Just lastly, right there, perfect. Looking at the curvature of her spine, it is nice and straight. It's midline. No abnormalities seen or palpated. Sit up, stand up. And her no kyphosis or scoliosis noted. And that concludes our head-to-toe assessment. Thank you.